Welcome to Dishin Nutrition Podcast, where we dish on trending nutrition topics, all the while making it easy and fun to understand. I'm your host, Sarah Williams.
And I'm your co-host, Emma Boland.
Hello. I'm really sorry.
She's back from the dead.
I'm back from the dead. I kid you not. Well, one, I went to Germany and I was like, I'm not even going to worry about it.
So fun. That doesn't need an explanation.
Yeah. I was like, I'm not going to worry about it. So super sorry. Secondly, the day we went to record the next episode, I came down with, it felt like a demon was inside of me.
It looked like it. When we came by to see you, she was like hunched over by the toilet. Like her eyes were like sunken in. I felt so bad.
I was not okay. I had the stomach bug and also solo parenting as well. So I was just like hanging on by a thread. So I was like, hey, can't do today.
So listen. I'm usually a people pleaser, but
I literally thought about not canceling so we could push one out, and I was like, okay, no, mental health is
setting boundaries is important.
But yes, so super apologies on the delay of content, but thank you for being patient, and you as well, Emma.
I loved
and being
it.
very nimble. But today I figured we'd go back in with a bang. One of these this topic that we're going to talk about today, we actually covered at the conference that I went to in Germany. The conference is called Foodfluence. It was a sponsored conference. It was a wonderful time to just delve into like the current nutrition research, and I was obsessed the entire time. But today we're going to be diving into the world of GLP-1s.
Ooh, love it.
What they are, how they work, pros and cons, who should be using them, who shouldn't be. I know when these first were coming about, which I know they've been around for decades, but like specifically the last 2 to 3 years, I've really made my stance on absolutely not. No. This is strictly diet culture. And of course, I think the conversation is more nuanced than that. Nuance number one.
Nuance count.
I think it's more complex than that. And seeing the data that I was presented to in Germany, I just kind of like, I didn't shift my mindset. I still am a firm believer that there should be a medical approval. I don't think it should be just the easy way out to lose weight. I think you should be a good candidate for it. However, I do think it's a really cool tool, and I'm kind of fascinated at the science of it. But yeah, of course, it's more deeper conversation than just that, of course.
Yeah.
So I retract any, not that. Any, but like I've made progress, and I am here to admit that like, hey, it's okay to say that your opinions have changed.
Really awesome.
Thank you.
To acknowledge that, because sometimes
I used to be really bad
it
about it.
can hurt your ego. You're
yes.
like,
because it's like, I made such a hard stance on like, this is diet culture. And don't get me wrong, it can be used for diet culture purposes.
100%.
Everything in Hollywood.
I think the media also,
it
blew up so quickly that it almost, because of the media, was turned into
It really fell overnight one day. I just felt like more people than not were on it, and I didn't realize it.
Yeah, and that's probably where that, for me, my bad taste came from that as well.
And I do acknowledge and recognize like how harsh I was regarding this weight loss medication. People were reluctant to come to me, and I don't want that. I apologize to anybody who's been like withheld that information. Not that they owe it to me, but like if it pertained to the conversation, and they withheld it specifically because they were afraid of how I would react or what I would say, like that's my bad, and I should be way more open to a topic.
That's so sweet.
Well, thanks. I'm trying to be a good person and
I love
receptive and have respectful, reciprocal
accountability
conversations. Yeah. Like that's the whole point of being a healthcare provider, right? Like you have to be open.
What is a GLP-1?
So what are GLP-1s? So let's give a backstory. The public interest in GLP-1s in the U.S. is unsurprising. Obviously, with the history of obesity and obesity-related illnesses, something had got to give within the medical community, and we were like, okay, what can we do that's obviously not lifestyle changes and things like that for particular patients, right? And I got this data from the conference, and it was 1 in 8 American adults have been estimated to have used a GLP-1 agonist. I'm just going to call them GLP-1s for the sake of this podcast. And then 4 in 10 among adults have been diagnosed with diabetes.
Oh, wow.
Yeah. So like diabetes is increasing.
Yeah,
and
clearly.
We need to do something about it, right? Because diabetes is a very tumultuous illness that can run rampant in your body if you're not careful, not taking care of it, and it can turn bad very quickly. And then the GLP-1 model forecasts 18 million people will be on GLP-1s by 2029 in the US.
Oh my gosh.
18 million people. That is the projection in the GLP-1 model.
It's
not something to ignore.
Yeah.
Yeah. And I was afraid to have this conversation because of, obviously, like I said before, my previous stances on it, my previous very controversial opinions, I guess. So it'd be ignorant of me as a medical professional to not have this conversation, honestly.
Knowing that is what's estimated.
Exactly. Yeah. It's gonna,
you can't ignore it.
It's not gonna go away.
Yeah.
It's only gonna go up. So GLP-1 medications belong to a class of drugs called GLP-1 receptor agonists. We did talk about this a little bit. I think it was the previous episode, but I wanted to dedicate an entire episode and spot on our feed for the information regarding GLP-1s. They mimic glucagon-like peptide 1, a hormone naturally produced in the gut that plays a key role in blood sugar regulation and like appetite control. Obviously, things that very much contribute to weight loss and weight gain. Originally, they were developed to help people with type 2 diabetes, but these medications have gained attention for their ability to aid in weight loss by reducing hunger and food cravings. And now food noise, which we touched on not last week, but last episode.
Yeah.
Yeah.
Side note.
Yeah.
This is me being curious. Did food fluents touch on like trizepatide and those types as well?
So we didn't touch on each one specifically.
Okay.
We just talked about GLP-1s as a whole.
Okay, gotcha.
We didn't talk about like Ozempic has a higher rate of this, trizepatide does this, Wegovy, so
Just curious.
That's a good question. But some common medications like Ozempic, Wegovy, Mounjaro, Trulicity, those are the ones that we're kind of talking about when we talk about GLP-1s. Now, how do they work? So they can work in kind of 3 different ways. This is going to be a little bit like more anatomy and physiology. So 1, it can work in by enhancing insulin secretion. And that can happen by stimulating pancreatic beta cells, which GLP-1s bind to the receptors on beta cells in the pancreas, triggering insulin release when blood glucose levels are high. So that's kind of what happens when you eat and your body's regulating the blood sugar by itself. Some people don't have that, or they have a lack of processes that allow that. So
your blood sugar spikes.
Exactly. Spikes, drops. Like there's no regulation to it. So it kind of aids in that. It can also reduce glucagon secretion, and that prevents unnecessary glucose production by the liver. And then also glucose dependent action. So unlike some diabetes medications, GLP-1s only stimulate insulin when needed, reducing that risk of like hypoglycemia. So instead of like having, apple juice on you at all times. This is not saying that won't solve that for everybody, but like that's just an instance. And then the second way it happens is it slows your gastric emptying, which is huge.
Yeah, people say that's the big one.
Yeah, so the food stays in your stomach longer, which is what they kind of attribute to the lack of food noise too, because that food is physically there and it is physically satiating you. And so you're not being triggered to think about, the food noise that influxes a lot of people's minds. And then that can lead to prolonged feelings of fullness, which is super huge.
Which does help in losing weight.
1,000%.
I mean, if you're feeling full, like after Thanksgiving, the last thing I'm going to do is eat food.
Exactly. I mean, like you don't need to eat because the food's literally still in your belly.
So if you feel like that all the time.
Yeah. So GLP-1 medications slow gastric emptying by binding to GLP-1 receptors in the stomach and intestines, which delays the movement of food from the stomach to the small intestine, if you wanted the actual like physical science behind it. And then the third way is regulating appetite. So that suppresses ghrelin, which is the hunger hormone, the dude who's yelling in your ear like, I'm really hungry, I'm really hungry.
Chick-fil-A sounds so good right now.
Exactly. And then that's me in your ear, actually. Just, hey, let's go get Chick-fil-A. While increasing satiety signals. So those are the 3 ways that GLP-1s work. It's really cool that all that's going on with one singular shot, which is medically cool, honestly. Like I nerd out on the science on it because it's like we have come so far medically. Like that's really cool that we can do that. All right, so let's talk about side effects. We're going to do positive ones. Let's start out on a good note.
On a good note. Okay, okay.
And then go to the bad.
Side effect number 1 is you cannot find your waist.
Side effect number 1, the FBI will be searching for your waist. No. So number 1 is weight loss.
Yeah.
But so clinical studies have shown that patients lose about 10 to 20% of their body weight on GLP-1s.
Amazing. If you are in the, correcting myself. If you are in the
space to lose that weight, of course. And then blood sugar control, amazing effect, helps lower A1C levels. I worked specifically in a population in New Mexico where a lot of my outpatient counseling was to lower A1Cs. And, that's really hard to do on your own. So this is really cool that there's a tool in your tool belt that could have a potential positive side effect of that. Or third, reduces risk of heart disease. So some GLP-1s lower cardiovascular risks in people with diabetes. So very specific to the population of people with diabetes, that is what's been studied. So don't want to say that as an overhaul, but could have risk, like lowers your risk of heart disease. And then the other potential is it's convenient because it's only a weekly dose. You don't have to remember, you don't have to set a timer. So that's deemed convenient, and I wanted to put that in there. Like,
I agree with that though. Like taking birth control every single day is such a pain compared to like a shot.
And then God help you if you forget.
Exactly.
Yeah, you could either get pregnant or you have hormone dips. Like, so I think
get pregnant.
Yeah, you could. Yep. So I think that's something to like definitely acknowledge. That's a really cool thing.
Definitely negative.
Now we're going to talk about the negative, and it's a longer list. With more serious side effects that someone really, really needs to weigh before they continue or start a GLP-1, right? So number 1, and they honed in on this a lot in Germany, is nausea, vomiting, diarrhea, and constipation. That's just one side effect. I put it all in one with bodily things, especially starting treatment. The doctor that was presenting said he was curious, so he gave himself a shot, like the lowest dose, and he said he had to call out of work for 2 days because of how nauseous he was.
I've heard nausea is the biggest one. That's what everybody of me would say.
I hate nausea with all my heart, and I think it's more so on my mind right now because I just had the stomach bug a week ago, but feels
like your world stops.
No, literally, you can't function.
You're like, how do I get up and do anything? Yeah.
And like, that's something to consider is, okay, so it may just be the first week of treatment. That may be manageable, but who's to say it couldn't happen the entire time you're on it? And that's something to weigh.
I feel like a lot of people, I don't know if the Food Fluence talked on that, but I feel like a lot of people.
Well, that's also why they don't eat,
that
right?
Consistent nausea
it's a very common side effect.
Yeah.
And I personally wouldn't want to live that way.
I don't want to live that way either.
So the second one kind of goes into the first one, is loss of appetite to an extreme degree. And that can lead to potential nutrient deficiencies, which kind of defeats the purpose if you're like, well, I want to lose weight to better my health. Okay, but if you're literally micronutrient deficient, like that's doing the opposite of what you're doing.
Now you're shaky and you're dizzy because you don't have like that. That's counter.
Yeah, it's counterintuitive.
Yeah.
Very good word. Something to just weigh. Of course, loss of appetite is what's going to get you to like not eat as much. But I don't know. I go back and forth again.
Yeah.
My stance is kind of wonky from the last time. Like I was like hard no, but now I'm like, well, in some instances I get it, but also like these negative effects are something to definitely not take lightly. And this next one, pancreatitis. Oh. It's a rare but serious inflammation of the pancreas. So if you're already someone who's predisposed, so you'll have like a family history of it. Like a lot of the times, I'm not going to say the statistic because I don't know it off the top of my head, but anecdotally, a lot of the times people know if there's a history of pancreatitis in their family. And if you're already predisposed to it, you are at a higher risk for having pancreatitis.
Do doctors, I don't know if this is just a random question. Again, I know a lot of this you got from Food Fluence. Yeah. I don't know if they touched on this. Do the doctors who are prescribing this look at, I mean, I know you're supposed to, but do they actually take it into account? Because like I texted you the other day, it was so easy for me to go online and get semaglutide.
Yes. So she sent me a screenshot of like this. It was a checkout cart. Basically, the only thing left for her to do was to pay for semaglutide to be delivered to her doorstep. And we can get into that later. I do have an issue with like the ease of that online without, talking to a doctor.
Actually, yeah.
But to go back to your original question, if doctors are looking at that, I just hope they are. Mm-hmm. Honestly, like if you're a good doctor and you have this ethical responsibility, like I hope they're looking at the familial history.
No, you're right. It comes down to the person.
Comes down to the person, definitely. If you are a doctor listening to this, I hope you are doing a complete overhaul of that person's medical history. Sorry, my dog's doing zoomies in the backyard.
Oh, the girl.
I hope you're doing a complete overhaul of that person's medical history because it's not, it could cause very serious complications like pancreatitis. That is such a painful condition.
Inflammation of the pancreas? No, thank you.
Horrible.
Ugh.
And then gallbladder issues. So increased risk of gallstones, especially with rapid weight loss. So you're already predisposed to that if you already have like a ton of rapid weight loss. So, but in this instance where the whole point is rapid weight loss, basically you're at a higher risk for gallstones and gallbladder issues. And then muscle loss.
Yeah, I've heard that a lot.
So if weight loss happens too quickly without adequate protein intake, you can lose muscle. I don't have the data, and I looked back on the notes. I don't think they stated any specific percentages, but I do know muscle loss regardless with weight loss happens. So it's something to keep, if you're doing it to better your health, but you can't even pick up your 45-pound kid, does it really help your health?
I also to that, and I mean this in the kindest way, but I feel like you can look at people
Ozempic face
and see Ozempic face and just see their semaglutide body where it's they're skinny but their muscles not there, so it almost looks
it's
wonky.
And
I don't mean that in a mean way. It genuinely just proves the point of it's pretty evident that
I get what you're saying. I have seen that when people post
celebrities I'm like, girl.
Yeah. No, I know other people who do
the opposition of that.
Yeah, they do the hard work while they're on the GLP-1s and they're, in the gym and they're like, I'm not going to lose muscle. Yeah. They're killing it.
And they look great.
They look fantastic and you can't even tell. They just look freaking ripped now, which is fantastic. But there is some work. It's not just a one size fits all. Just something to consider. And then the rebound effect. Yep. So if someone stops taking GLP-1s medications without lifestyle changes, which GLP-1s, so this was kind of where the data was kind of questionable. Doctors are kind of toying with the idea of just microdosing for long periods of time to just keep that constant, but also don't know what the data says about that. I go back and forth. I mean, I have to be on a forever medication for my heart. So I'm I can't be the one to say, I don't think you should be on a medication for your entire life. I go back and forth on it. So I'm not hard against it, but I'm also not a definitely for it. I don't love it because
unless because for you will die without your medication.
True.
But you're not going to die.
I guess that is a good point. Yeah, definitely. I don't know, because then if you need that, does it fix the root cause of, the weight loss and stuff? But then if it's for type 2 diabetes, I don't know. It's a definitely complex situation.
Have they done studies on that?
I know there were some longevity ones, but I can't recall the data from that. But it wasn't anything jarring enough, obviously, for me to remember. But I did note that the doctor that was presenting, he did say maybe microdosing is the future. So it wasn't my favorite. Don't get me wrong.
Yeah.
But
there's an argument for everything.
That's so right. There is an argument for
everything. So if we're going to argue about anything in this world.
Is the sky blue?
Yeah.
Well, I don't know. You could
that is a hard one though.
The sky being blue?
Oh. No, sorry. My ADD brought me back to
yeah, I was like, Emma, I'm not doing this with you right now.
No, but that is hard. Should we microdose?
Exactly. Yeah.
That's hard.
I
feel like should be a personal decision. Not
1000%. Yeah.
That's too much for me.
I would have to.
I need to partake in that clinical study in order to like have concrete.
This is Emma inputting herself into a GLP-1
Literally,
trial study.
If you think I'm really skinny, it's because I'm in a GLP-1 study.
All right, this brings us to who should and should not take this.
Oh, wait, hold on. I have a question
What's
also.
up?
Did they talk about the average recommendation for...
I know it's not a high dose. Are you talking about dosage?
Like for duration. So like, for example, like our company that I used to work for, who did it, like they only recommended it for 4 months. Whereas like other people.
They didn't give recommendations, but I did note most of the studies were like about a year long.
Really?
Mm-hmm.
People were on GLP-1 for a year?
Mm-hmm. Most of the studies that he cited did reference a lot of the people for about a year. Yes. Yeah. It was very specific to those types of populations. Of course, we don't have the data for like just regular Joe Schmoes going to like a medical boutique or whatever.
But I'm interested in that. Sorry. Side note.
Yeah. It might be a different conversation because it was for those different populations. Yeah. But yeah, as far as like an actual recommendation,
what's
obviously.
your thought on that? Just curious.
Like, what do you mean?
For a Joe Schmo, actually, that's too loaded of a question.
No, I mean, that's why we're talking about this, right? Like,
yeah,
and goes well with what we're about to say, like who should or shouldn't. So, I'll just dive into it. So, the primary use, what it was intended for, and what it was created for, was for those with type 2 diabetes or insulin resistance, potentially PCOS. Lots of studies need to be had about PCOS, right?
100%.
And like insulin resistance and all the things that go along with that.
I think they can be on it for a long duration. My question is like the Joe Schmoes, like.
Oh, well, I mean, I already have an issue with them being on it point blank period.
Yeah, right.
So, but if someone did find themselves in a situation, did not meet the criteria, and they were able to just get it offline and not really have to do much, I don't think it should be long-term at all. 4 months. Yeah. Like, if I had to give a recommendation, probably 4 months. I mean, recommended none.
Because if you're at 150, say you're at 170 pounds.
Yeah.
And for your height and whatever.
Yeah.
That is considered maybe overweight. So you go on Ozempic for 4 months. So that's what, 4, 8, 12.
You want to lose 20 pounds in 4 months?
Yeah,
is what you're saying?
Yeah, like I don't feel.
So the recommended for sustainable weight loss, it's like 0.5 to 1 pound a week is what's considered sustainable. So that's 17. So it's about on par. It's a little above. So it'd be like 1.5 pounds, little like 1.25 pounds a week. It's not horrid. Don't get me wrong.
So I guess.
But it doesn't get to the root. Yeah, and that would not be sustainable. You know what I mean? That's the one that I'm like, okay, you'll lose the 20 pounds, but that rebound effect is probably going to be at a higher disposition than someone who's like doing it for medical purposes. You know what I mean?
Yeah, that's so true. Unless, like you said, unless some people that we know who are on it, who already have great lifestyle, where they just need it.
They're doing the work.
Yeah, exactly.
Yeah. Like to say like they just did it just to lose the weight and not have to do the work. I think that rebound effect would be at a higher chance.
Even though I am interested in a specific influencer I know we've talked about, who went on a podcast about a year and a half ago, who was like, I gained, like, she talked about the rebound effect, yet now she went
back on it.
Tiny, and she's on it again. I don't know.
Has she owned up to it yet?
I don't think so.
I'm not going to name drop her.
I think she got a gastric bypass.
Are they combining those?
God, I hope not.
Yeah, I don't feel like that would be.
I feel like that's a lot.
I feel like you wouldn't eat like at that point, like right, like you. Yeah, I hope.
I don't know.
Correct me if I'm wrong. But if you're a doctor and you do work in this, like at a weight loss clinic,
yes, true.
Correct me if I'm wrong, and please point me to some studies that prove me wrong. But like, I feel like objectively that would not be great to do a gastric bypass and then
couple it with
like a GLP-1. I don't feel like that would be great. Yeah.
Me either.
That was pure speculation. I literally have no idea.
Yeah. Anyways, sorry. Side note.
And then other people who should use it or is deemed, a good clinical candidate for it is people with obesity or overweight individuals with weight-related health conditions. So obviously that can be a myriad of conditions. and definitely would be up to you and your doctor about if that was appropriate or not. You know, people who should avoid it. People with medullary thyroid cancer. I feel like that's on all, like any drug commercials. Like it's people with medullary thyroid cancer should not take this medication.
If you were a loved one.
Yeah.
have been impacted
you guys
by
sound like you have a lot of
mesothelioma.
predispositions to a lot of adverse effects. I would not do this.
I'm so sorry if you have
No, yeah. Like
whatever you just named.
They can't take a lot.
I know.
I feel really like that would be really hard.
And they have cancer.
Yeah. Well, yeah, exactly.
So
that alone is
I'm
not
so
great.
sorry.
And then people with history of pancreatitis, just steer clear. Right now, I don't think they've figured out I mean, it is because it's like stimulating the pancreas for those beta cells and stuff. So clearly if your pancreas has already been like punched before, it's going to be like, hello. Yeah. And then those who don't have a medical need for weight loss, but just want to use it for cosmetic purposes. That's my biggest qualm. Okay. Like I don't appreciate how easy it is to get it. I think that's my biggest issue is how easy it is. Granted, it is expensive. So like you definitely like, you're not getting it for cheap. It is a thing, but some people pull it out of their pocket and that's fine. But I don't love that you were able to like just hop online. Literally, it took you what, 5 minutes probably?
Like literally, it asked me to put in my weight.
Which you could have lied about.
I did lie about it because technically, when I first tried, it said I was. Which I know even your friend Steph talked about this too in her video about BMI is a whole nother subject. Yes. But it basically was like you're under the BMI threshold. So then I went back in and lied,
and no one's gonna double check that.
Exactly.
You're the one inputting the data, and of course that's an ethical conversation with yourself. And like, you need to look inward about like, okay, that is a disordered relationship. If you're willing to lie on medical documents, quote unquote, medical documents to get this stuff that it already deemed that you weren't a candidate for, and then went back and changed it to be a candidate, that's a whole other conversation, of course.
I also have qualms. Sorry, you're probably not going to like this with providers who are willing to also view a candidate and look at them and be like, I know internally as a doctor or a provider, they don't need it, but I'm still going to do it anyways because that's $400 in my book.
Oh no, 1000%.
That bothers me.
That's
as well.
gross. Yeah. It's absolutely gross. I don't think it should be
happening.
Oh yeah. I don't think it should be available at those medical boutiques. I think it's icky. It's just icky. It's ethically icky. You know, it's a deep rooted issue that the doctor has to look at themselves and go like, well, you know, but money talks, right? Money will always talk.
Money talk. Good song. No, it does.
And I would hope whoever has the power to prescribe these medications are doing it with the best intentions possible. But I mean, there's bad people everywhere. There's bad dietitians. There's bad teachers. There's bad police officers.
So true. That's a good point. We can't like.
There's bad Dollar General employees. Like, you know, there's bad people in every occupation.
Period.
I just have to believe the best in people, even though I know.
That's so true.
Yeah.
That's so true. That's a good point.
And then the last people to avoid, pregnant and breastfeeding individuals. I feel like that's obvious, but I just
in case
your baby's looking snatched. It's the residual Ozempic in the breast milk.
Your 6-week-old gastric whatever is not emptying.
That's not funny. It's not funny.
No, it's not. But you know what? There are some people I feel like might need to hear that.
Yeah, and I get it. Hold on. I hold space for that postpartum time in someone's life. It is a very vulnerable time. You have just given your body to this teeny tiny person who's continuing to demand your body. And then breastfeeding in and of itself is a whole journey. You're not going to feel like yourself. You're not going to look like yourself. I get it. I just made a joke, but I genuinely get it.
She gets it, y'all. Trust me. You don't even know her testimony to that.
You will do whatever it takes, you know, to get back to kind of look like yourself. So trust me, I get it. And I'm sorry, I shouldn't have made a joke. Cause like there are people who probably are like, I just want to look like myself.
I just want to feel like myself again, which is totally valid.
Exactly. But if you are pregnant or a breastfeeding individual, you do not need this medication flowing in your system for a myriad of reasons.
And I also do feel like that's a space too, like women who felt like they lost their body to pregnancy. I feel like there's a lot of, it pops up on my TikTok all the time, of women who went on it and they're like,
it's very vulnerable. And
yeah.
A gross doctor could take advantage of that.
Yeah. But they went on it and they did feel better. And if that's what's going to get you back to being a better,
I'm not like shaming it if that's what you want.
I know you're
but
not.
if you are, breastfeeding, you don't need to do it. So
just like if you're pregnant, don't get Botox. Like,
yeah, exactly. So are they long term? I have one more thing, and it's are you long term? I forgot I actually had this section, and we actually talked about like the recommendation for how long and stuff. So let's see what I wrote. I wrote this a week ago before I had the stomach bug. I love
it.
Okay, so one of the biggest debates around GLP-1s is whether they should be used short term or for life, longevity. For some, these medications act as a stepping stone, allowing them to develop healthier habits while they're losing the weight.
I like that.
And then get off and, be free from the nest, basically. You don't need to have your handheld anymore. You are free to make those decisions without that aid or the crutch. And then for others, long-term use may be necessary, similar to how people take medications for blood pressure or cholesterol. This is where that microdosing comes in. Patient dependent, definitely condition dependent. Like if you're just someone who does not have those predisposed conditions, you should not be on them long term, like I said. But the key is lifestyle changes. Obviously, give me a dime every time I've said lifestyle changes in every episode. A healthy diet, strength training
because
to prevent.
It rings true though.
Yeah, like that's the whole basis of nutrition. Strength training to prevent muscle loss and behavior shifts are what's going to be essential for that lasting success and not that rebound effect. And then weight management is not just about the number on the scale. That's heavy on that. It's about your overall health. So kind of like what we were talking about, if you're doing this in the name of health, but you're losing so much muscle, you can't lift something, what does that do? If you're doing this in the name of health and you're micronutrient deficient because you can't eat, is that really for your health? There's something to inner reflect on, So whether or not GLP-1s are part of your journey depends on your individual needs and goals.
That was a good episode.
I think I
loved it.
I don't feel like it was like harsh. I feel like I'm very open-minded to them now.
Which I appreciate.
Thanks. I was
really
hard.
do.
Like my friends, I've had actually 2 friends. Both of them have different conditions and they've come to me and they're like, hey, like I value your opinion, but I know you're going to hate what my doctor recommended to treat said condition. And I hate that they've said that. And then that's like the narrative that I've written for myself. And I hope maybe this will change people's opinions on it and make it them. Not that I'm like GLP-1s forever. Like everybody should be on it. Like it should be in the water. No, like I think it's a cool tool to use in the tool belt when it needs to be used. Like you're not going to use a screwdriver when you need to hammer something, right? Like you use it for specific times and situations. So yeah, I think if it's medically needed and your doctor is talking about it, open-mindedness, you can also say no, bodily autonomy. But, and if you're someone who's like, I don't want it, I don't want a Band-Aid, I want to fix whatever's causing it, I get that too. So both are valid and both are true. So GLP-1 medications, they're changing the landscape of weight management. It's really cool to see and be in this time to watch it. And diabetes treatment. So they offer real benefits but also come with those challenges that we stated earlier. So if you're considering GLP-1s, please work with a healthcare provider. Like please go to your doctor. Please go to someone. Please don't do it online. It's not my favorite. Just so someone can physically assess you, and then to determine if they're right for you. And remember, no medication replaces a balanced diet, movement, and sustainable healthy habits.
No, ma'am.
Boom.
Love it.
I did it. I literally told myself I probably would never talk about this stuff because it was like so
controversial.
Yeah, it was controversial. It's new, like it's scary. And then food fluence, I really was like, I need to stop. It's kind of like a cognitive dissonance to see all the positive effects and then me being like, well, I've already made my stance and I have to think they're bad. So I chose to embrace the information that was coming and I really appreciated it. I appreciate evidence-based science, but that's just me.
Like you're saying, this was also this is also okay.
Yeah, like all the data and everything was what was presented to me at Foodfluence, and is what shifted my mindset to what my previous opinion was. And I think that's what's really cool about science.
I think that's important that you are able to acknowledge that, though, because some people would take that to the grave. Yeah, and it speaks to how you do care.
Thank you
about what this industry. I want to be, and you want to grow your knowledge, and if that means you have to take something back and be like, actually, that's important.
Absolutely. My husband always says a good leader is humble, credible, and approachable. And yes, it's about leadership, but I also think that applies to whatever profession you're in. If you're like, I'm in the medical world.
And just as a human.
Just as a human, yes.
Seriously,
as a basis, you should be.
In this day and age, like politically, like you should be able to have a conversation without getting defensive.
Yes. And so I applied that and I was like, that definitely is applicable to many sectors of life. So good on you, Justin. You got to me.
Justin for general.
So thanks for having this conversation. Yay. I know you always like joked about GLP-1s, but like, cause you were like, I feel like you always made jokes about it. Like,
I was never against them.
Yeah. I knew that. And
well, you were always like, no. And
exactly.
Like,
so I was always like butted against that idea. Yeah. And then here's me eating crow.
Oh, it's not eating crow. I just think I like that you were able to acknowledge that.
Thanks. I appreciate it.
Because it hurts the ego.
Oh, my ego's always hit.
Oh, I know. Mine too. I think this was great.
This was a good conversation.
If you listen to the previous episode, sorry I was so like stern. Because I feel like I listened back to that episode and I was like, oof.
I feel like I was too.
Hard.
I was too. I feel like, right?
We were both very stern. I went on a tangent. So to anyone listening, sorry about that.
We love self-reflection.
Yes.
We encourage that. So, but if you enjoyed this podcast, if you think someone else would benefit from it, please share it. Please rate it. Please like it. Is that a thing? Just do it, please. Boost our ratings.
Send it to everybody you know, please.
I appreciate it. If there is a topic you want us to cover, please go to our Instagram, Dishin Nutrition Podcast. Go to the highlight reel. It says topics. Click it, and then you can put it in the box, and we'll look at it going forward. But with that,
you've been dished.
You've been dished.